The following segment is sponsored by Munson Healthcare.
In this month's segment of Your Health Matters, we're talking with members of Munson Healthcare's hand therapy team. The injuries that may bring patients to this team can sometimes make everyday tasks difficult to achieve, creating a huge impact on a normal day-to-day routine. But the experts are here to help. Heidi Biglin is an occupational therapist who specializes in hand therapy. That includes caring for patients with injuries anywhere from the wrist on up to the shoulder. As a certified hand therapist, Biglin works with her patients here at Munson Outpatient Services in Interlochen to develop skills for everyday living.
So in this clinic, for example, if somebody comes in with a wrist fracture, some of the activities that they may have difficulty with might be pushing up from a chair, or keyboarding for a job, driving, holding their baby. And those are important, meaningful tasks that they then need help achieving.
She wants her patients to meet their goals of getting back to life the way it was before their injury or surgical intervention.
That is everything to them. That is the most important thing. Quality of life is huge. Without quality of life, what's left?
And it means a lot to her too.
Seeing a patient go from A to B is motivation for me and for them.
Barb Wilson first started having issues with her shoulder 2 years ago during a skiing accident.
I had a very serious injury. They thought that the doctor was even surprised that I recovered as well as I did.
She's back in therapy now for her other shoulder, but this injury is from overuse. Stretching, heating techniques, and basic function exercises are just a few of the things Biglin has been working with Wilson on for the last few months.
I mean, when I started, I couldn't do anything functional. I could barely dress myself, wash my hair, any kind of anything like that. And now I can do all of the self-care. I'm grocery shopping again. I'm back to my volunteer work, different things like that.
She says the connection she's developed with Biglin during the therapy has played a huge role in her progress.
She'll step back and she'll work through the problem with me, work through whatever's causing the pain so that we can make forward movement after that.
Within a small community such as this, you really get to know not only just the patient, but you also kind of get a feel for their family, what they're doing at home, what role that they play within the community. So I think it's just bigger than just one individual needing therapy.
Wilson has several goals before summer arrives. She's hoping to get back to being active in the water with swimming and kayaking, and of course, to be pain-free. And with the progress she's made so far, her chances of meeting those goals look pretty good.
It's very hard when you've been very active to find yourself in that position where you really can't do what you need to do or want to do. And it's very good to be back being independent again and being able to volunteer and get back to work.
Everyone has unique needs when it comes to treatment plans. Those individual plans can include things like activities for daily living, arthritis education and intervention, pain control and strengthening, just to name a few. For a list of locations for hand injury recovery offered by Munson Healthcare, you can head to our website, upnorthlive.com. For Your Health Matters, I'm Megan Morelli.